Hello, good evening, everyone. I'm Dr. Maria Sulindro. I'm specialized in anti-aging or integrative anti-aging medicine, practicing in Pasadena, California. Thank you. Today, I would like to thank all the subscribers for getting me to 1,000 subscribers. And for those who have not, please do so and give me the upright like and share with your friends. Today, I'm going to talk about how and why do we have to prevent cancer. Now, first of all, it's easier to talk about why, because cancer becomes the third top cause of death in the United States, and especially also in many other countries. It is leading up high because number one, and also because cancer doesn't give you any warning. It grows very slow, and after so many years, the diagnostic test will detect it. And when the doctor confirmed after the biopsy, some of them they can tell by the look of what they see that you have cancer, then you'll be very upset, sad, panic, depressed, don't know what to do. And most of all, people always think that cancer kills. Now, what is cancer cells? Cancer cells is an old cells. Should happen in old people because as you grow older and when you reach, let's say, 100 or 110, 120, some of the cells cannot survive and they become old and they died. And if there are many of them, many of the cells become unbalanced and it can become cancer. I'm not going to talk about terminology that you might question. What is that, right? So that's basically, if you want to know why we have to prevent it, because it is possible. Now, can certain healthy food eliminate cancer? Now, why do we need to talk about food? Because food is what you live on. Like you have to eat to live, right? And not live to eat. You have to eat to live. And the food we eat many times give us very good pleasure and satisfaction because of the taste. And unfortunately, many people are very busy, and this is recognized by the industry. So they process the food so that it will give you the taste that you expected. Okay, the saltiness, the tanginess, the sugar, so the sweetness, and if you like sour, they'll make it sour. So all of these tastes, many of the tastes do not produce nutrition for you, but it just give you satisfaction in your tongue before they go into your body. I noticed lately because I witness some patients and also family who are on peritoneal endogastrostomy. So they eat from the tube in directly to the stomach because they cannot eat from their mouth. They cannot taste, right? They can probably sip and drink a little water, but some of them they can't. Either they have problems with the oral processing, or they just cannot do it. They lost the memory of doing it. Very sad. Now, that's the reason why this month, hopefully, I will talk about these food and nutrition, but I will use one of the scariest diagnoses, which is cancer. Unfortunately, the answer of can certain healthy food eliminate cancer is no. The food cannot stop the cancer or lower the risk to zero, but they can lower the risk of cancer. Now, that's for sure. Lowering risk is, of course, a training for serious people who is concerned because there is a family history of cancer and they do not know that there is a way to change this gene and suppress the expression of the gene, let's say, through the food or environment or lifestyle changes. So this is the purpose of this YouTube today. Okay? There is a test that shows us what kind of food or diet and nutrition and even exercise we have based on our gene. It's called genomic testing. Nutritional based on the gene, and they give you the way, according to the gene, the way to exercise based. So this is really personalized. It is a blood test and it is very unique to you. The question would be, if you know your nutrigenomic result, will you train yourself to follow it? Does it lower your risk of disease such as cancer or high blood pressure or cardiovascular health, which is heart attack? So the first three cause of death would be heart attack, stroke. So this includes hypertension and cancer. So this nutrigenomic is not new at all. So this has been there for a while. And why doctors do not test this? I'll give you the reason. I'm practicing integrative medicine. That's why I know about this one. And I like to test it so it's easier for me when you know what you need. And if you cannot do it, then we together will find out what's the best way to overcome your anxiety of these diseases that you might have through your gene. Okay, but why does conventional doctors or traditional doctors, you call it, do not test this? Or why, if I know and I don't test it for everyone? Well, number one, the test is only available in the past 15 years, and many doctors are not trained to be integrative or read the test. The conventional doctors trained to treat the disease, so it's easier for them to wait until you have it. Till you have cancer, they have the protocol: surgery, radiation therapy, or chemotherapy. That's the option you have from conventional. Now, we are here to tell you that you can prevent this cancer disease. It takes a couple more years to understand how to prevent the disease itself, even you know your genomic testing result. Why? Because it's not easy to change your lifestyle. Even you cannot change your environment, you can avoid it. But lifestyle is something that is already with you for many, many years. And only a very determined person and discipline can do it. Also, from the patient side, it has to start when they were very young enough, because changing lifestyle is difficult. Diet and nutrition and exercise is something that people enjoy, but it's not easy to change, right? Many failed because they have formed a habit. And when you ask them to change the habit, some of them, they are angry. For example, if a patient has already turns, let's say, 90. Okay, and they're very self sufficient at home, and they can cook, they can make up their bed, they can wash their dishes, and everything is fine as long as you don't change his habit. So once they said, oh, no, 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 you cannot go to Kentucky Fried Chicken or In and Out Burger, or you go to Shake Shack and enjoy all those fast food, because look, you'll have a heart attack. And they don't like it because heart attack, stroke, and cancer do not have symptoms. Like I said, it builds up in your system, and one day, boom, either you died, 30% kill you right away, which is very good, or happy because you are done with the misery. But the 70% live, and they deal with the disability. This is why we should prevent it, so that you are not one of them who will live for another maybe 10 years but disabled. Okay, now let's think about health insurance. The health insurance, many of them do not cover preventive measure. So it is preventive care. That's why you have to pay out of your pocket. So this is probably also why they do not like it, because patients who are not health conscious and they feel fine, they don't have any problem, no diabetes, no pain, no bloating, nothing. And why do I need to know that? I'm okay. I'm already 80. I'm already 90. I'm fine. Don't you play around with my lifestyle. Okay. They said they do not need it, and you cannot force them. Doctors who do not have the time to spend with those who do not seek their own optimal health, then they won't even mention it. Although they heard about it, they know about it, they just don't mention it. The relationship needs a few more decades, actually, before the community is aware of such preventive of cancer through food selection, nutritional supplementation, or exercise changes. All right. People are wondering what kind of healthy food we must eat to prevent cancer. Well, healthy can be tasty. Just need to learn how to prepare them. When you expect outside restaurants to prepare healthy food for you, you probably have to own the restaurants, or you know the chef. You can arrange that. But otherwise, they need maximum profit. So they use the least expensive oil to cook for you, right? Vegetable, they might not wash it carefully. So you're subject to parasite infection. Well, I'm just trying to give you some numbers, not to scare you or kill the restaurant's business, but this is the fact. I'm talking about the food that will make our body not deteriorate. Understand? So what are those? Now, let's talk about that. We know root of deterioration is inflammation. What kind of food are inflammatory is what you need to avoid. Number one, frozen food is inflammatory. So if you cook enough that you can eat that moment, or at least maybe finish it that day. If you keep it in the refrigerator, it must be the one that is, let's say, kimchi. Okay, you marinate kimchi anyway. So if you have marinating situations, you can probably keep it. Or if you buy perhaps like mustard, okay, you don't eat it right away and then throw it. No, but what I'm talking is food or dishes, vegetable especially. If you keep it and you overnight wait to eat the next day, then it become inflammatory food. But people would like to know what can they eat instead what they cannot eat? Now, I was told several times by some of my patients, don't tell me what I cannot eat. Just tell me what I can eat. Okay, so we should make fruit and vegetable, beans, whole grain be part of every meal. Just remember, vegetable, beans, whole grain be part of every meal. Any colorful leafy vegetable are okay. Whole grain, brown rice, quinoa, oatmeals. The idea is to avoid processed one, like white rice, white bread. So those are being processed already. Just avoid that if you can. What about protein? Lean animal proteins. Fine. Fish and chicken and protein from nuts, legumes, eggs, beans. Those are great. You can eat those. Low saturated fat, skim milk, low fat cheese like feta, and soy based food, nut milks like walnut is okay, non sweetened. How about cooking oils? Well, this has been back and forth, back and forth. I'm talking about coconut oil. Yes, coconut oil is heat resistant. You can use it. However, choose the one that they prepackage, maybe like each is like 2 ounces. So you don't keep opening the jar, because once you open the jar, coconut oil is easily rancid. Then you get the trans fat. So you can cook with avocado oil, grapeseed oil. Yeah, don't use cooking spray. This morning I just discussed with one of my friend about this cooking spray. No, they use an aerosol inside, and they use other things so that when you spray it out, it's oxidized and becomes trans fat. So do not use spray oil, just use a regular oil. Okay. Now I use a lot of coconut uh, avocado oil to cook. And cooking this pandemic season has teach us a lot of health issues that can be resolved if you cook at home. No added sugar beverage is the best. Water is the best. Warm water is the best. And I like hot water. And I think because if I drink cold water, I feel indigestion, and also my teeth is very sensitive. So I've been drinking hot water for many years, and I don't take coffee or tea or juice, but you can take green coffee, okay, but no sugar, please. And if you need to use sugar, we found a way. You can buy what we call monk fruit powder. I buys mine from Costco, and I think you can find it outside. And stevia. Some people do not like stevia because of the aftertaste, but monk fruit powder is very good. And some of the real organic honey would be better than processed sugar or refined sugar. Green tea is very good for health. Okay, so you can drink all those, but please avoid. See, I'm trying to tell you what is good, and I always go back to what to avoid. And I mean, to what to avoid, they don't want to know. What to drink, what to eat, they want to know. Okay, so I'm going to continue what to eat. Eating too much of any food will increase your body's fat. We know that. Thus, increase the risk of cancer. They found out about this. So be careful about this. And I would like to also share with you about heavy metals that usually distributed in the fat area. So if you have a lot of fat, then most likely you also have these free radicals of heavy metals, and that is not good at all. obesity linked to cancer according to the study. However, you can still eat healthy while you're trying to lose weight. People try to lose weight, they don't eat, and they eat very little of what they like to eat. Now, that is the mistake. Just cut the carbohydrate if you can. Simple carbohydrate, of course. And then you can still eat your carbohydrate from complex carbohydrates from vegetable. You get a lot of carbohydrates actually. So in some of the other YouTube I have, or we have accumulated many YouTubes, and you can also get some information about what to eat, what not to eat. Okay. Now, how about lower in calories, especially sugar, and high in fibers are the goal. This afternoon, I saw my daughter bought a spinach tortilla. So delicious. And that is high fiber, no sugar, very low carb, 3 grams in each probably. And it's high protein, high fibers, and tastes so good. So I just wrapped some nuts in there and I eat it like that. Oh, delicious. And I feel full. Okay. So low calorie, low sugar, high fibers are the goal. Don't be afraid of frozen vegetable, but eating vegetable fresh is when the vitamins are still there. We are talking about nutrition now. The difference. Diet is what you eat and nutrition is what you get. So if you can only get frozen vegetable, I would rather you get that than if you eat something that is not healthy, like something like, donuts or or sugar, like chocolate with milk sugar. So of course they are all delicious. However, I'm trying to make a point what kind of food that cancer likes. So you'll be eating all those good food and your cancer cells enjoy it too. So you grow together. That's not good, right? The food, eat food that has label, right? So you look at how much fat, how much salt, and how much sugar. Try to do that. And that way you learn. And so when you pick up something that you remember, oh, that's good. And then you pick up and you look at how much sugar is in there. If it's more than, like, say, 2 grams, just put it back. If you really like it and you want to have it once a year, let's say tomorrow is your birthday, 5 grams, okay, right? But when you pick up the food and it says 20 grams of sugar or 30 grams of sugar, that's for the cancer. Serious, the cancer loves sugar. Okay, with your permission, I want to tell you how to avoid processed food and what kind. Well, you know already probably. The meat, hot dogs, bacons, anything that even say nitrate-free or uncured bacon. Now, is it 100% to avoid? I think if you can, yes. But if you have to eat, don't eat too much because they're all processed. Limit red meat, but choose the protein from fish and chicken. Okay? Avoid alcohol. The less the better. Women maybe 1 servings and men 2 servings a day. Yeah? So always fill 2/3 of your plates with vegetable, fruits, and whole grain. How about that? Okay. There is no specific food you need to eat to reduce risk of cancer. But if you eat plant-based diet or food and maintain your weight, healthy weight, you definitely reduce the risk of cancer. I promised. Now, food to avoid due to increasing risk of cancer include, this is classified as carcinogenic by WHO. Those are the hot dogs, sausage, bacon. Those are classified carcinogenic by the WHO, World Health Organization. By now, everyone knows who WHO is because of the COVID, right? Now, this is connected to colorectal cancer. So cancer in colon and in rectum. So what do you eat to replace this processed meat? Well, you eat white fish, white meat such as chicken or turkey, or meat substitute like tofu, or have you heard of seitan? Not seitan. Seitan is the vegan protein from wheat, I guess, and all the vegetarian, they create this seitan, which is high in protein and high in fibers. So you can eat that if you want to, if you're vegetarian. Seitan is very high in protein. However, it is an incomplete protein source as it contains very little lysine and essential amino acid in seitan. And it is gluten-based for sure, but it's low carb, high protein for replacement of protein as vegetarian. Okay? How about red meat? Probably is not carcinogenic, but is probably carcinogenic. So it's not carcinogenic. It links also to colorectal. No evidence yet to pancreatic or prostate cancer, but it is probable carcinogenic. They look into it. When they look into it, there must be something wrong with the statistic. So you can swap this red meat with white meat again, fish and bean for the protein. Now, when you barbecue the meat or charred meat, you produce what they call heterocyclic amine. It's a substance developed in high temperature cooking. They think it's carcinogenic for colorectal cancer. So be careful when you barbecue and charred meat. Don't eat the charred meat. Do you know about alcohol? Well, this is a group 1 carcinogen. This is considered carcinogen. This affects the mouth, the throat, esophageal, breast, liver, stomach, and bowel. Everything. So be careful about this alcohol. Many people do not realize what they are getting when they drink too much of alcohol. What about salted fish? For Asian, we love salted fish. It is carcinogenic. And the alternative, of course, is you eat fresh fish, seafood such as prawn, mussel, and squid, but fresh, not salted one. In Asian market, they sell the even already the cooked one, salted fish, and they mix it with nuts. It's so good, and you eat it with porridge, but it is carcinogenic. When you drink about sugary drinks or non-diet soda, okay? Since obesity is a major risk factor for several cancers, okay? Those sugary drinks and diet soda is very important to understand that it will not maintain your healthy weight. That will ruin your weight actually. Now, you can achieve by not taking that, so maintain your balanced food and weight that incorporate all the healthy food. So please exclude excessive amount of sugar drink, and diet soda. I would like to talk about fast food or processed food. Greater because the fat from the fast food and processed food that cause many cancer because of the fat in there. It's from the World Cancer Research Fund. They recommend limiting fast foods and other processed food with high in fat, starches, high in sugar, and this, if you avoid that, it will help control your calorie intake and maintain healthy weight. So the important part is check your calories, maintaining your weight, right? Okay. VAT, that is excessive visceral adipose tissue, is associated with cardiometabolic disorder and chronic low-grade inflammation. Why? Like I said just now, the lead is in the fat of this fast food. They found lead in potatoes, right? So when you eat the French fries, you are eating lead, excessive lead. In fact, when we make the supplements now, and because we are based with food and vegetable, they force us to write there that this supplement contains lead and it can cause cancer. So if you carefully make the formula food supplement for healthy purpose, and they force you, the FDA force you to write it there so that people know that whatever is food-based and plant-based still contains lead. What do you think about these fast food? They don't care. They are not sterile. They don't care about the ingredients. They care about the taste, and they give it to you. So the alternative of that is homemade sandwiches or on whole grain bread or sushi or salad. Just make it from home so you can wash carefully and you understand what you are putting in your body. Now, I'm pretty sure during pandemic you have experienced that. Not only you can remove and reduce the carcinogenic by doing that, you also help reduce the risk of cancer. And just focus with general well-being, okay? Now I will go real fast here. Let me check if there is any questions. Okay, I will tell you the question later. And what food that can kill cancer cells? So that you know and you use it to prevent it before it grows wild. So garlic, this is proven with study. You eat garlic, raw garlic is very good. You don't like raw garlic, you can cook your soup and put garlic, and you can mince the garlic and just use garlic as much as you can, unless you are allergic to garlic. Monosaturated fats and polysaturated fats are known as good fats because they are good for your heart, your cholesterol, and your overall health. This fat can help to lower the risk of heart disease already and increasing good HDL. So if you eat the fat in that type of fat and avoid trans fatty acid and saturated fatty acid, which both can raise cholesterol and clog the artery and increase the risk of heart disease. And all these cholesterol things, cardiometabolic, they link to increase the risk of cancer. All type of soluble fibers, which will slow your digestion. It takes longer for your body also to absorb sugar or glucose if you eat fibers. So when you take a lot of fibers, then you will be able to absorb less of sugar from the food you eat. This helps prevent quick spike in your blood sugar level. And the important part is managing diabetes. Soluble fiber is similar, right? Managing diabetes is managing sugar. So this is good for lowering the risk or prevention of cancer. Soluble fibers bind with the fatty acid, flush them out of the body, and help to lower LDL, which is the bad cholesterol. You know, it's not bad, but you call it bad cholesterol, low density lipid. Insoluble fiber, insoluble fiber helps hydrate and move the waste through your intestine. Now, this is helping you to move your bowel. That's one thing it does that help prevent constipation and keeps you regular. That's the insoluble. The high fiber diet may help reduce your overall calorie intakes and help you maintain healthy weight. This is vital to reduce cancer risk. There are two types of fiber, like we already mentioned, soluble and insoluble, but both are part of healthy diet that help lower your cancer risk. Healthy food and vegetable that caught attention of people who researched that might reduce the risk of the risk of cancer or prevent cancer. Spinach. Now I tell you what is in the food so you know why it prevent cancer. Okay, spinach has chlorophyll, and this one reduce the liver cancer. Spinach. Turmerics slower the growth of cancer. So it is an antioxidant and protect the cells from free radicals. So turmeric is also one of the spice you use to cook curry. And Indian people use that a lot, and I like it, and we eat a lot of curry also. Tomatoes, it has lycopene, vitamin C, vitamin K. This one reducing also cardiovascular disease. Onion and leeks, the Mediterranean diet, the famous one. That is very good. I like onion and leeks. Hopefully you like it too. Now, the first one, the raw garlic actually prevent stomach, esophageal, pancreas, colon, and breast cancer. So inside the garlic has allicin and allyl sulfur. Allicin and allyl sulfur. It comes also, all of this comes also in capsules, and you can get it as a food supplements. Watercress vegetable or salads is an antioxidant. Many of the Mediterranean people, they eat this one, and Asian also. This prevent DNA damage. Green tea, it has phenolic compounds in the green tea. Salmon, it's anti-inflammatory because it has the EPA and DHA, mainly DHA, very good. In 2012, University of Oxford and International Agency of Research Cancers, they published this one. That's why it's very popular, and many insurance cover now the omega-3 that contains EPA mainly and also some DHA. Colorectal cancer risk in the study was reduced by 12%. That's a good number. You know, Brazil nuts is the nut that is big nuts. It contains selenium, which is antioxidant. Well, selenium is also available in fish, cottage cheese, and pork. Surprise. So this selenium protect us from colorectal cancer. The study was done by Cornell University and Arizona University. Have you heard of beer story? BEER. So after the Second World War, the water quality was very bad. So instead of drinking water, people drink beer. And later on, they found out that in the process of beer brewery, they actually use acid hops plant, HOP plants. It contains humulus and lupulus. The humulus is alpha acids and the lupulus is beta acid. This publication was out in 2007, and they use rat models. So they create the rats and give the rats cancer, stomach cancer, and they injected the humulus and lupulus. Apparently it has chemoprotective effects, and it induces apoptosis. Apoptosis is cell death of cancer cell by 70% from the humulus and 50% from colorectal cancer. So drinking beers apparently has some value, which is prevention of stomach cancer. I was so surprised. Now, before I close, I'd like to talk about a little bit about this genomic testing, the gene-diet interaction. This one, it has been there because there was a diagnosis called inborn error of metabolism. Basically, these babies were born with a rare genetic or inherited genetic disorder in which the body cannot properly turn food into energy. This study was published by Dr. Sananda Mondal and Debashis Panda on November 9, 2020 in peer-reviewed Journal of the Nutrition. Nutrigenomics strategy that can be applied to the study of prevention of many diseases, of course, including cancer. Without changing the DNA, the modification of epigenetic events can change the heritable changes. Okay, so those are changing your diet, your lifestyle, and recognize the environment. The summary of today's talk was from food that reduce risk of cancer, food that promote inflammation, food that reduce inflammation, the fat problem in the food intake that increase the risk of cancer, and the nutrigenomic testing. Now, if you miss this video, you can go to, if you miss this live chat, you can go to the video and also ask questions, and I will make sure that I see that and then answer it. One moment, I have this one. Okay. So now before you leave, make sure you check out some of my other videos. If you haven't already, please like this video, subscribe, and then share, and turn on the bell notification. You can follow me on Instagram. My information is in the description box. There is description box when you see it later. I go live every Thursday in English at 5 o'clock Pacific Standard Time, and on Friday, 5 o'clock Pacific Standard Time in a different language called Indonesian. And thank you very much. I see you next Thursday. And if you have any question again, keep your question, and you can ask next week. Next week will be food for patients who are diagnosed with cancer already. Thank you. I'm Dr. Maria Sulindro, integrative anti-aging medicine. I'm practicing in Pasadena, California. Thank you very much for the support. Bye.